Botox Forum, where we answer questions regarding botulinum toxin and do an overview of the research that's been out in the past month or so. I have two papers and one question that came up. The first, let's cover one of the research papers, and then we'll get to the questions. All right, treating bruxism, as you know, is in the sweet spot where you have a stack of research supporting the use of botulinum toxin to treat it and the associated headaches, but it's not yet covered by insurance. So that's in a sweet spot, so you can still be accepting insurance for other things, but take cash when you do this. And it is one of the most safest, easiest things to learn. If you go to our membership site, which you're a member of if you're watching this, and you look at my demonstration of how to treat it, then you see something similar. I think they complicate it with this. But what the study provides, which has not been done well until now, is they did EMG studies to show that it actually works. They draw you a pretty picture where they define the safe area. You draw a line from the corner of the mouth to the earlobe, and then you palpate the master muscle. So easy to do. And then they consider the safe space to be what's inferior to that line, and the inferior border would be the inferior border of the master muscle. What's inferior to that line, and even with the posterior border of the master muscle and 1 centimeter posterior to the anterior border of the master muscle. So if you consider the master muscle as being this square, then a centimeter away from the mouth puts you into the safe zone. A simple way to do this is just palpate the muscle, and they did 4 injections. The way I do it, it works great for just headaches, is you just palpate the muscle and you put 1 injection right in the center of that. You have the dosing and the way I find that spot on our course, but it's not out of, it still hits the target. They just have a more elaborate way of finding the target, and they put 4 injections instead of one. With hypertrophy, and when you're treating that, say in a Asian woman or a woman with, which often happens with bruxism, but sometimes without bruxism, if someone just wants to have a more feminine contour with the accentuation of the cheek and the emphasis of the master muscle, which can be masculizing, then in an Asian woman, this usually requires 50 units per side, so a whole body of 100 units of cosmetic botulinum toxin. And in that case, I do 3 injections at different depths. And I teach you how to do that in the course. But the point I'm making here is for bruxism, you have another study supporting it, and this is open source. So you put a link to this study, and I'll put it in the transcription, but you could put a link to this study in an email and say, hey, here's research that this works. We treat it. And the other nuance about this is that for some reason, still only about half of the states in the US allow dentists to do Botox. So you would be helping someone who may have been only offered some sort of contraption to wear at night. Okay, I'll save this last paper. The quick version of the question I got, we will come in probably under 15 minutes today. Easy stuff. The quick version, the question I got was when you inject botulinum toxin for erectile dysfunction with 100 units, is it okay to bump it up to 200? Absolutely. If you look at the LD50 for botulinum toxin, we're routinely doing 200, 300 units for migraines every 3 months. So this is still in a very safe range. And the Zeeman company did the study showing that even at 100 units, many men had still active results at 9 months out. So if you're treating ED or whether you're treating this retracting penis and the man just wants it to be more visible in the flaccid state, either way, 100 units is really the starting point, and you can go to 200 to 300. And along those same lines for our clitoxin procedure, we did the original study, my wife and I, with 50 units, but it was based more on the idea that it just hadn't been done before then. And we were being very conservative. 50 units would be nowhere near enough to treat migraine. But if you believe our postulate that the mechanism of action is not relaxation of smooth muscle, but rather modulation of the autonomic nervous system, then the mass of the clitoris in relation to the mass of the penis is irrelevant because you're using both sides as a port to facilitate axonal transport to the ganglion, in the case of the woman lining the vaginal wall, to communicate with the midbrain. So in that case, the dosage would not vary because the clitoris happens to be smaller than the penis, and perhaps we should be using in the same way 100 to 200, 300 units in women. But we've routinely bumped it to 100, and we haven't done the study yet, so we don't know. But anecdotally, it seems to be working perhaps better than the 50 unit dose. So all that's explained on our clitoxin website about how to do that procedure. But the main thing I wanted to stress here is that, because this is on the website, how to inject the penis. If you're doing that, it's acceptable to bump it to 200 to 300 units. Now, last study, and then we will end this unless someone else has a question. That was the main question that came up this past month. Do white noise or music relieve pain caused by botulinum toxin injections? And their conclusion is that they do. And this was reassuring to me because if you've done my hands-on training, I have an album that I've played over and over again that I consider to be the most relaxing album ever. Recently, the artist passed away about a year ago, but I give you the album in the course and tell you I've played it almost without exception every time I've injected cosmetic botulinum toxin. When I do parties, I'll often just pull it up on my phone and play it on my telephone, even if I'm not in my office. But almost always in my office, it's playing. And I'm conditioned like Pavlov's dogs. When it plays, I become relaxed. I'm less rushed, and I think my patients have the same reaction to it. I have mentioned that I studied to it all through medical school once in a workshop, and another physician who was training with me that day, prominent gynecologist out in Texas, said he listened to the same album all the way through medical school. I don't think that's coincidental. I think it's magical. And I think if you pull it up, it's George Winston's December album, and you play that while you're injecting botulinum toxin. No one's sure exactly why it works, what it's triggering in the brain, but music helps. And if I were choosing music, that's I do choose music every day, and that's what I choose. I think with that, let's see if there are any more questions. And if not, we will call it a day. Okay, I hope that's helpful. Have a great day.